I'm Renee. I'm Dr. Gazzelli's physician assistant and second pair of hands during surgery. Today I'm going to review with you your upcoming procedure of a posterior cervical fusion. I'll review the procedure and recovery time with you. Please feel free to take notes. I'm happy to answer any questions you have or go over more detail with you face to face. This is not meant to be comprehensive, so I do expect you'll have questions, but hopefully this gives you a good amount of information on the procedure, the day of surgery, and recovery time. So on the day of surgery, you'll be arriving at Rose Medical Center, and you will arrive 2 hours prior to the surgery. We do operate at Rose regularly, so we have a consistent team of anesthesiologists and surgical team that we work with regularly. Initially, you'll be brought back into the pre-op holding area, and this is where nurses will start an IV and get things prepped and ready. They'll make sure all current medications and medical history and everything is updated in the computer. You will meet the anesthesiologist prior to surgery in that pre-op holding area. Sometimes they'll call you the day before, so if you get a call from a number you don't recognize that day or evening before surgery, you may want to pick it up because it could be that anesthesiologist just trying to chat with you and get to know you a little bit. Of course, you'll see Dr. Gazzelli before surgery in the pre-op holding area as well, so he can go over final questions that you have at that time. As far as approximate time and family expectations, typically a one-level fusion will take us about an hour and a half to 2 hours. If you're having more than one level done, you can add about 20 to 30 minutes per level. We're happy to keep family members, friends, or whoever's there with you updated throughout the procedure. The operating room nurses can call them and keep them updated. Dr. Gazzelli will also call them or come see them after the procedure. So if they're there at the hospital, he can come sit with them face to face and chat with them. And if they can't be at the hospital, that's okay. He's happy to call them on the phone and discuss the procedure and how you're doing at that time. As far as what happens in the operating room, you may have already watched the procedure video, so you have an idea of what is entailed in the procedure, but this will give a little bit of a recap and go over some frequently asked questions. This surgery is done under general anesthesia, and we do have people in there monitoring your nerves and spinal cord during the surgery. So after you're asleep, they're going to come in and put little baby needles all over from head to foot, and that monitors the spinal cord and the spinal nerves during the procedure. So if anything starts acting abnormally, they will let Dr. Gazzelli know right away. I like to mention them and warn you about them a little bit as well, because if you wake up with pinpricks, bruises, and bleeding, that's what that was from. All those little needles everywhere. The other thing with this procedure is the positioning. Because we're working on the back of your neck, we want to keep your head stable during the procedure, and in order to do so, we actually attach tongs to your head that then attach to the bed. So you will have 1 or 2 little tongue divots on either side of your head, and these are placed after you're asleep and are removed before you wake up. But we put those in to help stabilize your head during the procedure. So I like to mention them because you may end up with a little bit of betadine or antibiotic ointment in your hair, and on occasion one of those little spots might bleed a little bit. If that's the case, sometimes we have to put a staple or 2 in there, so there might be a staple that needs to be removed. Once everything's positioned, the incision is typically made in the middle of your back of your neck, and we'll move the muscles aside to get down to the spine. If a decompression is necessary, we can bring a microscope in to assist us in making sure we can see everything nice and clear. And then bone will be removed and a decompression would be performed in order to take pressure off of a nerve root. Then screws and rods and bone graft are used for the stabilization or the fusion. Once all of this is completed, the incision is closed, and this is closed with layers of dissolvable suture. Oftentimes the top layer, however, is closed with staples. We will then put a gauze bandage over there and put a collar on you before you wake up. Depending on how many levels, this could be a soft collar or a hard collar. You will then be transferred over to the recovery room where the nurses will watch you and monitor you while you're waking up and becoming more alert. They'll help control any pain or discomfort that you're having with the medications. And once you're alert and awake enough, you'll be transferred over to the surgical floor. And at Rose Medical Center, we do have a spine and orthopedic floor that you would stay on, and there's nurses and physician assistants on that floor that work with our spine patients regularly. All rooms at Rose are private, so you will not be sharing with another patient. We will have pain medications and muscle relaxants available to you to take as needed, and the nurses will help dispense those. We'll also have physical therapists and occupational therapists working with you while you're there, just getting in and out of bed or a chair, walking, basic daily living activities. You will be in a gown most of the time that you're there, but you're welcome to bring any loose, comfortable fit clothing to wear or at least to go home in when you do go home. And you're welcome to bring any toiletries from home or other necessities such as that. While you're there, you will see Dr. Gazzelli or myself on a daily basis. And if you're there on a weekend, you'll see Dr. Gazzelli or myself or one of our other surgeons or physician assistants who may be on call that weekend and taking care of our inpatients. So you will see somebody from our team every day. You will be discharged home once your pain is relatively controlled and you're cleared by physical therapy and occupational therapy. You will be discharged with muscle relaxants and pain medicines. You should get those prescriptions to go home with, and you can take those as needed as you've been doing in the hospital. I do want to remind you not to take anti-inflammatories for 3 months after surgery. So that means Advil, Aleve, ibuprofen, Motrin, naproxen, those types of over-the-counter medicines or even prescriptive anti-inflammatories, none of those for 3 months after surgery. As far as what to expect initially and restrictions that we place on you, we do want you alternating positions and walking. Walking is going to be your main therapy for the first 8 weeks. We ask that you not do any lifting greater than about 10 pounds and really no overhead activities. I had said earlier that I wanted you alternating positions. I don't want you bedridden or chair-ridden after the surgery. If you're sitting around watching TV or reading at home, I want you to get up and move around every 45 minutes to an hour, whether it's just to get a drink of water, go to the bathroom, or even take little walks throughout the day, even outside if you wish to. Initially, keep it to multiple little walks throughout the day, and as you're feeling more up to it, you can stretch those to fewer, longer walks. But this will be your main form of exercise initially. We'll also have a collar for you, and depending on how many levels, it could be a soft collar or a hard collar. As far as showering and wound care goes, you can get the incision wet and shower starting the 2nd day after surgery. So you'll take the outer gauze bandage off and shower like normal, letting the soapy water trickle down the back of your neck. Just try not to let the water pound on the incision, don't scrub back there, and don't soak it in a pool or a bathtub. So just showers only, and when you're done with the shower, pat it dry and put a new dry gauze bandage on it. So the goal is to keep it clean and dry, and no need for any ointments, lotions, or creams on the incision. With the medications that we give you for pain medicines, oftentimes those can cause some constipation. So we usually recommend it for as long as you're taking pain medicines that you stick with a stool softener. And of course, step it up to laxatives if you needed to, if the stool softener wasn't enough. If you switch over to diarrhea, of course, stop any stool softeners or laxatives. As far as driving, we ask that you not drive as the driver up to your first post-op visit. We really want to keep you restricted of driving because of the collar as well as the medications that you may still be taking. So we'll discuss clearing you to drive at your first post-op visit. As far as work goes, you can work from home whenever you feel clear enough and want to do so. If you have an office type or sedentary type job, you're welcome to get back into the office within the first 1 to 2 weeks. Usually I'll recommend that you go back part days at first, because going back for a full work day right away is often too much. It just makes you too sore and too tired. So if you have the capability of going back part days for that first few days to week and then increasing to more normal full-time hours, that's great. For those of you who have more physically demanding jobs like construction workers, you're going to be out of full duty longer because we do restrict you initially as far as your physical activities, and then we won't release you to full duty until we get you strengthened up more with physical therapy. So it could be about 3 months or so until we're releasing you to full duty. We of course could get you to light duty earlier if your employer or job have that capability. As far as complications or other things to expect, there will be some incisional pain or numbness, of course, from the skin and muscle disruption. And usually the normal post-operative pain for this is going to be back of the neck, upper back, shoulder region. And a lot of it's muscular, which is why we want to make sure that you have a muscle relaxant. And you can even use heat or ice back there if necessary over the bandage or in the upper back area. You may even have some persistent nerve symptoms after surgery. So if a decompression was done or pressure was taken off of a nerve, oftentimes the symptoms are better, but they may not be 100% gone because now the nerve needs to heal. And nerves heal slowly, and so it can be a little bit of a process to get it to fully resolve. So it's normal for you to have maybe less frequent, less severe symptoms, maybe good days, bad days. All of that is normal as long as it's better and getting better over time. Occasionally a nerve will get aggravated that we were in there, however, and in those cases a patient could wake up with similar or increased nerve symptoms, whether it be pain, tingling, numbness, or weakness. If that happens, we'll calm that acute inflammation and irritation down with some medications, some nerve stabilizers or steroids. And there's one particular nerve we like to talk about, which is the C5 nerve, and that comes out at C4-5. So if you're having that level operated on, we like to mention this because it's the most easily irritated nerve. People can wake up with what's called a C5 palsy, and that's where they have significant weakness in their shoulder and their bicep. If this happens, we'll monitor you very closely. It typically will get better with time, but we do help it along with some medications to help decrease that inflammation and stabilize that nerve. Of course, we're operating around the spinal cord, so people worry about paralysis. In some cases, we do decompress over the spinal cord, but not all cases. We will have the neuromonitoring in there to monitor your spinal cord. We're also very slow and meticulous anytime we have to go near the spinal cord because you don't want to disrupt it or move it. So we'll keep things very slow and gentle around that area, and again, bring in a microscope if needed as well. There's always the question of wound infection. Wound infections don't happen very commonly, but the posterior neck incisions are more notorious for getting infected. And that's somewhat because of the part of the body it's in, or the location of the body that it's in. As far as it right around the hairline, it's sometimes just a little bit easier place that gets dirty and sometimes gets infected. We do give you antibiotics during the surgery and during your hospital stay. We typically do not send you home with antibiotics, however. So just keep it clean and dry, keep an eye on it. And like I said, no need to put ointments, creams, lotions, or anything like that on the incision. As far as when to call us, any changes in nerve symptoms, strength, increasing weakness, increasing pain, numbness, tingling, those types of things, please let us know. As I said earlier, it's normal to still have some symptoms kind of come and go, hopefully less frequent and less severe. But if you start getting symptoms that are getting worse and not getting better at all, then please let us know. Also, any persistent fevers or signs of infection. Watch the incision for any signs of redness, swelling, drainage, things of that nature. Please let us know. And any persistent nausea or vomiting. Let us know and we can help you out with medications for that as well. And when you will see us next, we will see you back at your first post-op visit around 7 to 10 days after surgery. At that visit, we'll remove any sutures or staples. We will get x-rays at that visit and review them with you. We'll also just review how you're doing in general and refill medications if necessary. At that first post-op, we'll also talk about driving and if we can clear you to drive or not. We'll then see you back at 4 weeks after surgery, and then again at 3 months, 6 months, and 1 year after surgery. We will get x-rays at every visit so that we can monitor the fusion and monitor the hardware. And getting you back to normal. At 4 weeks after surgery, we'll be transitioning you from a hard collar into a soft collar. Now, if you've just had one level operated on, you're more than likely just in a soft collar for the first full 8 weeks. So at 8 weeks out, we will then start weaning out of the collar altogether and starting physical therapy. We'll give you an order for this so you can get that taken care of. And then with physical therapy and in conjunction with physical therapy will allow you to start increasing your lifting, your overhead activity, and your normal activities. The physical therapist can help guide you in getting you back involved in normal exercises, sports, or physical activities. And hopefully this has given you a good amount of information as far as the surgery goes. I will mention that the fusion itself, again, is monitored, and the actual bone growth can take about 6 months to fully heal or fuse. So we'll continue to monitor it over those months as well. I'll remind you not to do anti-inflammatories for 3 months after surgery, and we'll get you going with that physical therapy at that 8-week mark and get things advancing as far as your activities. So please feel free to call us or email us with any further questions or concerns, but hopefully this gave you a good amount of information about the procedure and recovery time. Thank you.